So I talked about social health determinants and said where we were born, where we grow up, where we age. Are these social health determinants, are they basically similar throughout the United States?
So what we can tell you is that the social determinants of health are similar between different communities across the country, but they do impact communities differently. So for example, when we talk about politics, let's say as a social determinants of health, politics here in the Bay Area will play out very differently than they do in San Diego or Kansas City, New York, or Florida.
So how would that affect, let us say, the way seniors might be treated or the way some other group might be treated?
So in a community like Silicon Valley, for example, where many of the jobs that we have here are focused on the tech industry or the biotech industry, the types of workers that those types of industries are looking for are different than perhaps the types of skills that our seniors might bring. Our seniors who were born a while back and grew up and were educated and learned how to work in certain industries may or may not have the educational and the work experience to be able to be successful in a community that focuses on technology and biotechnology.
So Pastor Bussey, um, have you seen, well, how would you define how social determinants are affecting people in your church or areas in which you've dealt? Have you seen any impacts?
Absolutely. One of the impacts that I've just dealt with is where I had a member who needed to get some information from the doctor, and the doctor was saying, well, you can go online and get it, or you can call this number and get it. And I think that what happens is that with all the technology that is in this area, practitioners forget that seniors weren't born as digital natives. And so if they know anything about the computer, they know very little. If they have a phone, it's now a smartphone because that's all you can buy, but they don't know how to operate it. And so it leaves them really on the fringes of service unless they have someone in their family or a friend who is technically able to help them to do what they need to do. So the impact of it is, I think, pretty severe.
Interesting. Sandy, can you hear us? Sandy, are you with us?
Yes, can you hear me?
Yes, we can hear you now. You started, I mentioned in introducing you that you've been working in this area for at least 20 years, and you introduced certain initiatives. What type of social determinant initiatives were you involved in, and how did you get involved in the field at all?
Well, I entered actually the public health field first having been a community and labor organizer. So I think I came in with a perspective that so many other things in life impact your health and well-being than just whether or not you have access to health care. So I think I kind of came into the field with that perspective already. But the initiatives that I primarily started working on that were focused on targeting the social determinants early on were, I think that the determinants that we really started working on early on were around land use. The idea of how your community is designed, what you have access to, what the air quality in your community is like, whether or not you have opportunities readily available to exercise or to buy the goods and services you need, whether or not you can afford to buy or rent a place to live that is safe. All those things have a huge impact on health. And so the initiatives that related to the social determinants that we first started working on were around land use. And then, over time, we've expanded our initiatives both in Alameda County and across the Bay Area to address other things beyond land use, including economics and including educational attainment.
Okay, we'll talk about some of that a little later on. How, Edith, did this whole area, the topic area, social determinants of health, how did that come into being?
Well, what happened in the 1990s was some of the health officers and public health directors around the San Francisco Bay Area. I'm just talking about in the Bay Area in general. They got together and they started to have conversations around whether or not there were health issues that they should work on or we should work on a regional level. So they talked about things such as housing and how housing cannot be solved in one city or even in one county, that housing really is a regional issue that we need to be addressing. Transportation is another example that they felt, you know, if there are things that need to be done around transportation, we can't try to do that just in our county or just in our city. We need to be working collaboratively across different jurisdictions here in the Bay Area. So that's how it started. Then they invited other health departments around the Bay Area and came together and started to have a discussion around what the priority issues are that we should be addressing as public health departments if we really wanted to impact health positively. And one of the things that they noticed in taking a look at the data is that when we put a lot of resources on dealing with one health condition at a time, that we may or may not have an impact on that health condition, but that health condition is impacted by so many other factors, the social determinants of health, that if we found a way to be able to address the social determinants of health, there would be so many health conditions that we would be addressing at the same time. So by addressing things like housing, you would be addressing things like tuberculosis, other communicable diseases, and you'd be also addressing things like physical inactivity, eating healthy, and things like that by working more upstream instead of dealing with one health condition at a time.
That's fascinating. Pastor Bussey, how did you get involved in the whole area of social determinants of health?
I got involved in a most interesting way. I was approached by a friend of mine, Gloria Rhodes Brown, who said to me, "Did you know that there's math displacement going on?" And I said, yes, I did, because as a counselor for 25 years, I had worked to help parents to override teacher recommendations because their children, by their records, were misplaced. And so I had a town hall meeting in June of 2013, and that was all that I thought it was going to be, as a town hall meeting to inform the neighborhood. The church was packed, and so many people said, that happened to me, or they knew someone that it had happened to.
When you talk about misplacement, math misplacement, what does that really mean?
What that means is that a child in middle school has received the grade of an A, earned the grade of an A or a B in Algebra 1, and rather than them going to high school and being allowed to take the next course, which is geometry, certain children were being forced to retake Algebra 1. And when you do that, the 12, 13-year-old brain says, I don't want to do this again, I already did it. And so what they do is they don't do the work. They just kind of give up. They're like, I don't want to do this.
You said certain children, so should I simply assume you're talking about children of color?
I am talking about children of color because disproportionately it is children of color who have been required to retake a math class that they've already been successful in.
So we're talking social determinants of health. How would you see that, Edith? Or even Sandy, if you're following along, how would you place that as a social determinant of health? Sandy, would you like to answer that? I did ask Edith, but can you hear us?
Yes, you're talking about educational outcomes as a social determinant?
Yes, yes.
Well, so education is a key determinant. The connection between education, life opportunities, and good health is absolutely clear from the research. It's actually one of the strongest predictors of income. And obviously income opens up employment opportunities, higher quality work, safer working conditions. Folks with less education are more likely to work in low-skilled, low-wage jobs that are significantly more dangerous, more stressful, and as a result, they usually they live sicker and shorter lives. And so, obviously, education provides the skills and knowledge for employment. But beyond that, people with higher education are also able to develop more develop networks with other people through employment that have higher paid jobs, and those provide future opportunities. They also tend to be able to develop stronger interpersonal skills that can lead to supportive relationships and things like that. So education is a key determinant of health.
So are we talking about the ideal in terms of disparities and getting rid of the disparities in terms of education? Is this an ideal circumstance?
I don't think so. I think it's something that we can and we must make a reality. Because the other thing that happens to students when you force them to repeat something that they've already had success in, it becomes a mental health issue. They become depressed as a part of feeling like they're not good enough, they haven't proved themselves enough. And so when depression begins to enter in, they begin to act out in class, and then they become a discipline problem, and it just snowballs into some really sad places for these children. So I think that we have a responsibility as a society to force school districts to do the right thing by children and allow them to move from one course to another, as they have proven that they're capable to do.
Now, that's just one instance of maybe a social inequity or a disparity that can snowball throughout a person's life and
Yes.
might be snowballing for a group of students. Is this something that's isolated?
No, it isn't. Actually, the research that Pastor Bussey is referring to happened between San Mateo and Santa Clara counties, taking a look at all the schools and the transition between 8th grade and 9th grade across all those schools. If this is isolated, it may happen to one child in one school going to a specific high school. It shouldn't be happening to child after child after child. And then when you see the pattern where this disparity is happening to very specific groups of people, whether it's in Santa Clara County or in San Mateo County, something else is impacting those decisions that teachers or school districts make that hold back those children from taking the math classes that they should be taking. And math is a very important subject because it's one of the few subjects where, whether you're a college in Connecticut or you're a college in San Diego, you know what the pattern should be. Children should be taking Algebra 1, Geometry, Algebra 2, and then they may take Pre-Calculus, and then Calculus 1 and Calculus 2. So if you're not able to take, if you take Algebra and then you have to retake it again, you lose a year in mathematics. And by the time you get to be a high school, you have one less opportunity to be able to take the advanced level classes that you might have needed to be able to be competitive for the universities you might have wanted to enter.
Well, you talked about county health departments collaborating. So I'm going to ask you, Sandy, since you've worked in the area of social equity, how do you tackle an issue like that? It seems to me that might very well boil down to racism or prejudice. So how do you deal with an issue like that?
Well, I think one of the things that we're trying to do as health departments is to educate the greater public about the connections between these different social determinants and health outcomes. I think that when people hear that, across the board, we see sometimes a 10, 15-year difference in life expectancy for children born in one community versus another. And I'm talking in the same city, but it's like whether you're in a poor neighborhood of color or in a wealthy white neighborhood, the life expectancy for children is completely different. And that's just fundamentally not fair, and I think that speaks to pretty much everybody, that sense of that any child that's born should have the same opportunity to lead a long, healthy life and not automatically be able to count that they're going to live 10, 15 years less just because of where the conditions under which they're born and then how that's going to snowball throughout their life. So I think that's one of the things that we try to do is really just try to educate the public and policymakers about the connections between these different determinants and the decisions that get made in those determinants, and then how that ends up turning into really different health outcomes down the road. We're also looking at, and I think that by kind of highlighting the patterns that Edith was talking about and really making that data much more transparent, we, at the end of the day, the policymakers have to look at why are their decisions impacting certain communities a certain way, and what are some of the underlying assumptions that they're bringing into the decision making that they're doing. And so yes, it is very hard, but I don't think it's insurmountable.
Sure, sure. So since it's not insurmountable, Edith, can you tell me, is there an example that can be given where the data has changed a policy?
Absolutely. I think that one of, we have many examples where data has changed a policy. Probably a very recent example within the work that we do in San Mateo County is in the area of tobacco. One of the data pieces that we're taking a look at is that asthma rates seem to be higher in multi-unit housing facilities. Our community started to become interested in what we can do to protect the health of children who live in apartments, in condominiums, and townhomes. And there became more interest in seeing if we could make those facilities be smoke-free. So there is now a movement across the state, but specifically in San Mateo County, to get our policymakers to consider whether we should make apartments and townhomes and condominiums to go smoke-free. And the data was used to show the support and the impact of those housing conditions on the health of people who live in them. So Stanford University came to many of our community meetings to talk to our policymakers around when you have two apartments next to each other and one person is smoking in one apartment, how much time it takes for the smoke to travel to the next apartment, and how that's going to impact the health of whoever lives in that apartment. Whether they smoke or not, they're breathing in secondhand smoke, and that could impact their health. And if there are children with asthma in that apartment, how that could negatively impact their health. And a child with asthma who gets sick with asthma might not be able to attend school, thereby impacting their own educational attainment possibilities. So we use that data, a lot of research data. We survey the community to find out what their perspectives are around being exposed to secondhand smoke if they live in apartments. And we brought all that data to policymakers to show them that there actually is community support for turning apartments and condos and townhomes smoke-free. And so little by little, our cities, one at a time, are taking a look at that and considering whether or not that makes sense for their community.
That's fascinating. Would you take a position, or have you taken a position? Have you seen any data? Of course, you've worked in the area of math displacement, but have you seen any other data that you think merits action?
Well, the Silicon Valley Community Foundation has a plethora of data on this particular subject. They have done all of the work, and I'm really happy to say, we started the St. James Community Foundation as a response to try to help level the playing field for students of color. And we've been quite successful with that, but next Wednesday I'll be in Sacramento testifying at a hearing for Senate Bill, I believe it's 359, it's the Mathematics Placement Act of 2015. And I'm really excited about that because the data is what has pushed this issue to the forefront and allowed the folks in Sacramento to realize that there really is a problem, that it's very, very widespread, and that this treatment of children needs to be stopped through legislation. And so I'm thrilled that that we're going to be testifying next week, and hopefully we'll convince the folks in Sacramento to pass this legislation.
Before I get to Sandy, what type of law can stop math displacement? Since whether to promote a child or not, is that up to the individual teacher?
It is not. It is teachers do have the right to issue grades, but they must issue grades based on what the child has performed in their class. So really, it's not about teachers giving grades, it's about students earning grades. And if a student earns a passing grade, then that student will, if this bill passes, will be automatically placed in the next course. And that's all we're asking for, because as Edith said earlier, when a student is forced to repeat a course, they lose a year. Having a student repeat the same course for the third time absolutely destroys their confidence.
A third time?
Well, because if they've taken it in algebra, if they've taken algebra in 8th grade and passed it, and then you say, no, you have to show us again, and they take it in 9th grade, and they fail it because they're so discouraged, then the system can say, you failed it. Now you've got to repeat it again. And so you can have a student take the same course 3 times before they get to move to the next course. And by that third time, their chances of four-year college are out the window. They're completely gone because you have to get through at least Algebra 2 in order to qualify minimally for four-year college. So then they're relegated to the two-year college system. There's nothing wrong. I love the community college system, but I think it should be a choice, not a student's only option.
So Sandy, what Pastor Bussey seems to be dealing with are issues that involve racism. So I'm wondering, are there other issues, since you've worked in the area of social equity, that brings up that this type of concern? Did you hear me, Sandy?
I did. I think that the fact is that we have a country that was based on racist practices. And it's kind of almost like in the air we breathe, I believe. And it's permeated, I think, decision-making throughout our country's history in many ways. We really see that, the creation of neighborhoods of concentrated poverty that are, as just by accident, some would say, also happen to be neighborhoods that are concentrated people of color is no accident. And that ends up impacting the opportunities that people have that live in neighborhoods of concentrated poverty. I think laws like Proposition 13 that really impacted the funding of public education. I think some of the underlying values behind the passing of and the maintenance of Prop 13 is around racism as well. So yes, I do believe that structural racism permeates decision making in many areas.
Well, that's
not blatant or even obvious to people that they do have. They are continuing to help permeate some of the past practices.
So while you're talking about that, how do you deal with that? Do you first have to change public attitudes? Do you aim towards changing policies? Do you aim towards changing conditions? How do you attack a situation like that? That seems to be systemic.
Well, I think you probably have to do all three. But I think oftentimes we've seen that the best way, certainly with the civil rights process, the best way to combat a lot of the racism was through policy change that mandated certain things had to happen a certain way, and public opinion more or less eventually caught up, but it didn't start with public opinion change first. And so I think it's, obviously you can't change policy if you don't change the opinions at least of a significant enough sector. But I think you have to focus on policy change if you're going to make systems change.
Sure. Thanks.